there, my name's Tegan. I'm going to be your nurse today. Is now a good time to come in and assess your baby? Okay, sounds good. How have you two been doing? That's great. When did you guys last feed? Okay, and are you doing breastfeeding or bottle feeding? And how long did she eat for last time that you did your feeding? Okay, good. And is she eating a lot or a little? A good amount? All right. Just always remember, try to feed as many as, or as little as 8 to 12 times every 24 hours. So I'm going to go ahead and get started on my assessment. I'm going to go ahead and listen to her heart rate, respiratory rate, and take her vitals. So I'll listen to 1 full minute for each. And then I'll go ahead and listen to her bowel sounds while I'm here for a full minute. Alright, everything sounds good. Her heart sounds strong and her lungs sound good. No increased effort of breathing. I'll also go ahead and take her axillary temperature. Alright, good. I'm going to start by looking at her head. So her fontanelles are both open and soft. That's great. Her sutures are currently overlapping, which is normal. And then I don't notice any lumps, so that's great. Her ears are in line with her eyes, and her eyes are symmetrical. Nose is symmetrical. I'm going to go ahead and do our rooting reflex, and then the sucking reflex. Then I'll go ahead and feel for her soft and hard palates. Those are both intact and soft. Her mucosa looks pink and moist. That's great. And then I don't notice any white lumps or anything on her face or any pearls in her mouth. I'll go ahead and look at her eyes. Alright, the mucosa looks nice and moist. No drainage or jaundice, which is awesome. So her neck looks nice and freely movable. Her clavicles are strong and intact. Go ahead and do my ototonic neck reflex. Alright, good. Her arm came out on the side and her leg as well. That's awesome. I'm going to go ahead and do capillary refill on her chest. Alrighty. I'm going to go ahead and assess her brachial pulses. And her arms are nice and freely movable, very strong. I'll do my palmar grasp, nice strong grips. And I'll go ahead and look at her creases on her palms. There's 2 or more on each hand, that's good. She has 5 fingers on each hand. Go ahead and palpate her belly. Nice and soft, non-distended. Her respiratory effect looks good. She's a belly breather, which is normal for babies. No labor breathing or anything like that. That's awesome. Move down to her legs, do her femoral pulses. Nice and strong. Good, 5 toes on each foot. And I'll do my plantar grasp. Good, her toes curled on each thumb. Good, and then I'll do my Babinski's reflex. Very good, her toes sprawled out like that. Take her diaper off real quick. Okay, nice clean diaper right now. Her labia majora is over her labia minora, which is good since she's a preterm baby. She has a patent anus, which is good. Alright, I don't notice any abnormalities there. good. Her spine looks nice and intact. And then I don't notice any sacral dimple, which is good. I don't see any bruising or Mongolian spots or any evidence of birth trauma or birthmarks.
But I can just set up my phone.
That's awesome. Her skin is normal for ethnicity.
Go to cycling.
No marks. I'm gonna go ahead and do a startle reflex. It's good. Her arms came out. And then we'll do our stepping reflex. Good job. Alrighty. I'm gonna wrap it back up real quick. Alright, so just a reminder, safe practices. So always remember her security tag is on her umbilical cord, which is currently still attached, nice and currently still pink and moist. Security tag is attached, and her name band is on. And then always make sure she's sleeping alone in her crib, on her back, and with nothing but the bulb syringe in her crib. Is there any questions that you have for me right now? Alright, that's awesome. I think that's really it. If you would like to see a lactation consultant or anything like that, we can definitely get that set up for you. Otherwise, she looks great. And yeah, you just call me if you need anything. I'll make sure her crib is locked and your call light's in reach. So, thanks.